It all starts with something you've probably had before, a really sore throat. But not just any sore throat. We're talking about a specific kind called strep throat. This isn't caused by a virus like most colds are. Instead, it's caused by a tiny troublemaker, a type of bacteria called Streptococcus. When these germs set up camp in your throat, they can make swallowing feel like you're gulping down sandpaper. You might also get a fever, a headache, and even see little white spots at the back of your throat. It's a nasty infection. But luckily, it's one we can usually fight off quite easily with the right medicine from a doctor. So why are we making such a fuss about a sore throat? Well, the real danger isn't the sore throat itself, but what can happen if you don't treat it. If you leave those Streptococcus bacteria to have a party in your throat for too long, they can trigger a much more serious problem. Your body's amazing immune system, which is designed to protect you, can get tricked. This leads to a condition called acute rheumatic fever. Think of it as a massive overreaction by your body to the strep throat infection. It's a serious illness that can affect your joints, your skin, and even your brain, but its most dangerous target is your heart. The journey from a simple sore throat to a heart problem is a step-by-step process. First comes the strep throat infection. If that infection isn't stopped with antibiotics, your body's defense system goes into overdrive about 1 to 5 weeks later. This is when acute rheumatic fever can begin. It's at this stage that the real damage starts to happen, quietly and inside your body. The fever can cause your joints to become swollen and painful, maybe your knees one day and your elbows the next. But the most alarming part is the silent attack it launches on the heart, which can lead to permanent damage. This is why seeing a doctor for a bad sore throat is so incredibly important. A quick test can tell if you have strep throat, and a course of simple antibiotics can wipe out the bacteria completely. This stops the infection in its tracks and prevents it from ever getting the chance to confuse your immune system. By treating the initial problem, you are essentially building a wall that stops rheumatic fever from ever developing. It's a simple action that protects your body from a chain reaction that could have very serious consequences for your heart later in life, all because of some untreated germs. Your body has a brilliant defense force called the immune system. Think of it like an army of super soldiers, always on patrol, looking for invading germs like bacteria and viruses. When this army finds an enemy, like the Streptococcus bacteria causing your sore throat, it creates special weapons called antibodies. These antibodies are custom-made to find and destroy that specific germ. They lock onto the invaders and signal to the rest of the immune army to come and get rid of them. It's a fantastic system that usually works perfectly to keep you healthy and safe from all sorts of nasty bugs. But sometimes, things can go wrong. With an untreated strep throat infection, the Streptococcus bacteria have a sneaky trick up their sleeve. Parts of the bacteria look very similar to some of the healthy cells in your own body, especially the cells in your heart, joints, and skin. So, when your immune system makes those powerful antibodies to fight the strep germs, these antibodies can get confused. They are programmed to hunt for a specific pattern, and unfortunately, they find that same pattern on your own healthy tissues. This is a case of mistaken identity on a microscopic scale, with devastating results. This confusion leads to something called an autoimmune reaction. Auto means self, so it literally means your immune system is attacking itself. The antibodies, still searching for the enemy they were built to destroy, start to attack your own healthy cells. Imagine your body's soldiers being given a picture of a bad guy. But that bad guy looks exactly like some of your own team members. The soldiers doing their job would start attacking everyone who matches the picture. This is what happens inside your body during rheumatic fever. Your heart valves, which are crucial for your heart to work, are one of the main targets of this friendly fire. The result of this attack is inflammation. Inflammation is your body's response to injury or attack. It's what causes the redness, swelling, and pain you see with a cut or a bee sting. When your antibodies attack your heart valves, they become inflamed and swollen. This process doesn't just happen once. If you get strep throat again, your body can launch another attack, causing more and more inflammation. Over time, this repeated damage leads to permanent scarring, and that is what we call rheumatic heart disease. It's a long-term condition caused by your own body's defense system accidentally hurting you. Your heart is an incredible pump, working non-stop to send blood all around your body. To do this job properly, it has 4 special doors inside it called valves. These valves are like one-way gates. They open to let blood flow forward from one chamber of the heart to the next, and then they snap shut tightly to stop the blood from flowing backwards. This open and shut action has to be perfectly timed, creating the lub-dub sound your doctor hears with a stethoscope. The smooth, efficient flow of blood depends entirely on these valves working perfectly. opening fully and closing securely every single second of your life. During rheumatic fever, the confused antibodies attack these delicate heart valves. This attack causes the valve flaps, which are usually thin and flexible, to become inflamed, swollen, and sore. Think of it like a door hinge getting rusty and swollen. It won't open as wide as it should, and it won't close properly either. Over time, and especially with repeated attacks of rheumatic fever, this inflammation leads to scarring. The valve flaps can become thick, stiff, and even fuse together. This permanent damage is the core problem of rheumatic heart disease, and it messes up the heart's ability to pump blood efficiently. This damage can cause two main problems. The first is called stenosis, which means the valve becomes too narrow. Because the scarred valve flaps can't open all the way, the heart has to work much harder to force blood through the smaller opening. It's like trying to push water through a pinched garden hose. The second problem is called regurgitation, which means the valve becomes leaky. The scarred, stiff flaps can't close tightly, so after the heart pumps, some blood leaks backwards into the chamber it just left. This is incredibly inefficient and puts extra strain on the heart muscle. Whether the valve is narrowed or leaky, the result is the same. The heart is put under enormous pressure. It has to pump harder and faster just to get enough oxygen-rich blood to the rest of the body. Over many years, this constant extra work can cause the heart muscle to become enlarged and weakened. Eventually, it can lead to heart failure, a very serious condition where the heart simply can't keep up with the body's demands. All of this serious, life-changing damage can be traced back to that initial untreated strep throat infection and the chain reaction it started. Because rheumatic heart disease develops slowly over many years, a person might not notice any symptoms for a long time. The initial damage happens during acute rheumatic fever, but the signs of a struggling heart might only appear a decade or more later. When symptoms do show up, they are often because the heart is working too hard and can't pump blood effectively anymore. One of the most common first signs is feeling breathless. You might get out of breath doing simple things that used to be easy, like climbing stairs, carrying groceries, or even just walking. This happens because your lungs are not getting blood cleared away efficiently. Another key symptom is feeling extremely tired all the time. This isn't just normal tiredness after a long day. It's a deep fatigue that doesn't go away even with rest. This happens because your body's organs and muscles aren't getting enough oxygen-rich blood to function properly. Your heart is working overtime, but it's not succeeding, leaving you feeling drained. Some people also experience chest pain, or a fluttering or racing feeling in their chest, which are known as palpitations. This is a sign that the heart's rhythm might be disturbed because of the strain it is under from the damaged valves. Sometimes you might notice swelling in your legs, ankles, and feet. This is called edema, and it's a classic sign that the heart isn't pumping strongly enough. When the heart struggles, blood flow slows down, causing fluid to back up and leak out of the blood vessels into the surrounding tissues, especially in the lower parts of your body due to gravity. In more severe cases, you might also experience fainting spells or feel dizzy. This is a serious warning sign that your brain is not getting a consistent supply of blood and oxygen, which requires urgent medical attention. It's also important to know the signs of acute rheumatic fever itself, as catching it early can stop the heart damage before it gets worse. The symptoms include a high fever, painful and swollen joints that seem to move around the body, for example, a sore knee one day, a sore wrist the next, and sometimes a painless rash with wavy edges. In some cases, people might experience jerky, uncontrollable body movements. If you or someone you know has these symptoms, especially a few weeks after a bad sore throat, it is absolutely critical to see a doctor right away to get diagnosed and start treatment immediately. The best way to deal with rheumatic heart disease is to stop it from ever happening in the first place. This sounds complicated, but it's actually incredibly simple. Treat strep throat infections promptly and properly. If you have a very sore throat, especially with a fever, go to a doctor. A quick throat swab can confirm if it's strep. If it is, a course of antibiotics, usually penicillin, will kill the bacteria. It is so important to take the full course of medicine, even if you start feeling better after a few days. This makes sure all the germs are gone and prevents them from triggering that dangerous immune reaction. If someone does develop acute rheumatic fever, the treatment goal is to reduce inflammation and prevent more damage. Doctors will use strong anti-inflammatory medicines, like aspirin or steroids, to calm down the immune system's attack on the body, especially on the heart. They will also prescribe a long-term course of antibiotics. This isn't to treat the current infection, but to prevent another one. People who have had rheumatic fever are at very high risk of getting it again if they get another strep throat, so they often need to take a low dose of antibiotics every day for many years, sometimes even for life. For people who already have rheumatic heart disease because of past damage, treatment focuses on managing the symptoms and easing the strain on the heart. Doctors might prescribe different medications. For example, diuretics or water pills help reduce swelling by getting rid of excess fluid. Other medicines can help the heart beat more slowly and regularly, or help relax the blood vessels to lower blood pressure. These medicines don't fix the damaged valves, but they can help the weakened heart work better and allow a person to live a more comfortable life for many years. In severe cases, when the heart valves are too damaged for medicine to help, surgery may be the only option. Surgeons can sometimes repair the damaged valve, stitching it up so it closes more tightly. More often, they have to replace the valve completely. They can use a mechanical valve made from durable materials or a biological valve from animal tissue. Valve replacement surgery is a major operation, but it can be life-saving, restoring proper blood flow and taking the immense strain off the heart. But remember, all of this can be avoided. A quick trip to the doctor for a sore throat can prevent a lifetime of heart problems. It's that simple.